This week on Healthy Living, a look at the state of healthcare access in Africa. Health experts sound the alarm over the high number of people who lack access to basic health care. In Malawi, Cyclone Freddy survivors struggle with waterborne diseases including cholera. Plus, what causes a stye and how to get rid of it. That's in this edition of Healthy Living. Hello and welcome to Healthy Living. I'm Mkamiti Kibayasi. Access to health care is a necessity for people everywhere. It is the ability to obtain health care services such as prevention, diagnosis, treatment and management of illnesses and disorders. About 52% of people in Africa have access to the health care they need, according to a report released by the Africa Health Agenda International Conference in 2021. Medical experts say healthcare access must be available, affordable, and convenient. Zimbabweans living on the border with Zambia are increasingly taking advantage of their neighbors' superior health care. However, Zambian officials say they are also draining their nation's resources, as nearly 1/3 of patients in some clinics and hospitals are Zimbabweans. Columbus Mahvunga reports from Lusaka, Zambia.
One of the people lying in this cemetery in Lusaka, Zambia, is Mavis Banda, a Zimbabwean who died earlier this month at the University Teaching Hospital, Zambia's largest hospital. No one followed Sibanda to Zambia or claimed her body. Lusika Manikwawo, a fellow Zambian who befriended Sibanda at the hospital, had tried to take care of her. She explains how she felt burying Sibanda in Zambia away from her relatives.
I was hopeless because the job was just too much for me. I couldn't bear it. I felt bad as well, because someone to just die like that without relatives.
Kambanikwawo said Sibanda had left 3 children in Zimbabwe. Tafadzwa Masimba, a nurse from Zimbabwe who works in Zambia, says she understands why her fellow citizens are seeking health services here. It's free to those who can't afford it.
You can access any health service that you want at a government hospital, and then it's usually for free. If you have to pay, it's like you pay just a very low amount. It's very affordable. And then there are also doctors everywhere here. It's like the doctors are in the hospitals 24/7.
Imran Raymond Vaidia is a social aid officer with IK Charitable Trust, a non-profit that has been assisting foreigners, including Zimbabweans, who come to Zambia for medical treatment.
We normally assist foreigners, especially Zimbabweans, in repatriation to get back to where they came from, 2, we also assist Zimbabweans in purchasing of spectacles. We also assist Zimbabweans in payment of lab tests. As you all know, it is very difficult for a foreigner, especially a Zimbabwean, to be put under NEMA.
NEMA manages Zambia's national health insurance. Ministry of Health officials declined to reveal the cost of treating Zimbabweans in Zambia. Natalie Mashikolo of the University Teaching Hospital says Zambians treat Zimbabweans as their relatives.
Obviously, you would expect if a patient from Zimbabwe comes here, it's just automatic for you to know that when you look at them and you assess them, you know that these people the Zimbabweans cannot pay. So that's why we cannot turn them away. And when they're discharged, we contact the embassy and see if there's any way they can help. If they can't manage to help, then we bring in our cooperating partners.
These cooperating partners include IK Charitable Trust, which assisted in Sibanda's funeral. Many hope that Zimbabwe improves its public health system so its citizens do not die abroad seeking medication, as in the case of Sibanda. The Embassy of Zimbabwe in Lusaka and the Ministry of Health in Harare could not be reached for comment. Columbus Mavunga for VOA News, Lusaka, Zambia.
What is one area of healthcare or health service that needs immediate improvement in your community? Here are some reactions from Mombasa, Kenya.
It's high time for both national and the county government to allocate more funding on healthcare services.
My view is that most of the people should be sensitized about the importance of NHIF, so that most of those low income, so that when they get sickness, they can also get insurance, so that they can be able to be taken care of the medication.
So does it mean that you are talking about universal health care for all Kenyans?
Yeah, the universal health care for all Kenyans. And if there are those who are not able to pay, the government should make some portion of the income of the allocation from the government, so that they can pay to those who are not in the good. They are not able to pay that amount.
What should be done immediately, it is to revamp the hospital with the proper medicine. Number two, the masilai, the welfare of the doctors should be implemented so that they can have the morale of the work in those institutions.
When you access these primary level facilities, you'll come to realize that there are so many challenges that have not yet been tapped into. Like number one, we don't have youth standalone friendly centers in these health facilities. Another challenge that we have as a county or as a country at large is whereby to get youth healthcare providers or a healthcare provider who has been trained on how to engage the young people, how to talk to the young people, how to offer services to these young people.
Wondwossen Abebe Gebreyes is the Executive Director of Global One Health Initiative. He spoke to VOA's Edeni Bekele about the challenges of healthcare access and what can be done.
Countries, regions, the continent Africa has to embrace a One Health approach. What's One Health approach? It is really looking at the interconnectivity of human health with animal health and the environment, because majority of emerging infectious diseases in humans, particularly, are of animal origin. 65% or more are of animal origin. When you think of the environment and insect vectors, the more than 75% of emerging diseases in humans are of this, in One Health approach, because this integrated approach is necessary to prepare. Secondly, I think African countries must build their capacity. Capacity building is critical. It's not just about the workforce. Their healthcare workforce is very much overstretched. Laboratory infrastructure capacity are very important. But also the third part is we have to recognize these issues are transboundary between countries. So Africa needs to develop, of course, Africa CDC, AU has now a CDC platform, which is wonderful, connecting the continental efforts. But neighboring countries regionally need to also have this transboundary collaboration. The fourth thing I would say is also improving supply chain. Supply chain is a major challenge, especially now. We have proven that the whole planet has been in a major challenge currently for supply chain, healthcare, pharmaceuticals, vaccines, others. So Africa is really disproportionately impacted by supply chain shortage of vaccines and others. So I think African governments must increase their investments, their core budget for healthcare purposes. Currently, it's much small. Often they expect from donors. So we, as myself of African origin, I think African governments, I would say, must increase their proportion of healthcare expenditure. First of all, and we have to measure how much efforts are there in terms of prevention of diseases, prevention of epidemics or pandemics or chronic diseases. Because prevention is, it's focused before the damage is done, right? You save lots of lives, but it's much more also cost effective. I think focusing on prevention will also allow governments to evaluate the healthcare access.
In Malawi, Cyclone Freddy is gone, but the talk about its effects remain. The devastating impact on human lives is deep, and many communities are coping with serious health challenges, including an outbreak of cholera.
Poor sanitation, worsened by lack of running water and adequate toilets in evacuation camps, is exposing Cyclone Freddy survivors to waterborne diseases, including cholera. In Zomba, East Malawi, some survivors have raised concern on lack of clean water to the extent that some of them are drinking the flooding waters. Elestina Chambo, a Cyclone Freddy survivor at the Chambo Evacuation Center, is afraid she may catch waterborne diseases, including cholera.
We draw water from the nearby river. The river lies lowly from a nearby graveyard, located a bit high up. In the same area are pit latrines. With the rains, the latrines are filled with water, and all that stuff is being swept into the river we draw water from, posing a risk of cholera.
Gomezgani Nyasulu, disaster desk officer in Zomba, says there is an outbreak of scabies in some camps in Zomba, including Chambo Evacuation Center.
To make even things worse, at this Chambo we've reported today cases of scabies, so you understand how scabies can spread in a place like this, and how sanitation plays that low in places like this. So we are appealing for any support that anyone can have. It will go a long way.
A Cyclone Freddy survivor, Catherine Tichale, says people are facing malaria risk because they have few mosquito nets.
We need these insecticide-treated bed nets. Without them, we'll be infected with malaria. We're aware that malaria is a dangerous disease. It may look simple when we talk about it, but malaria can kill both children as well as adults.
The flooding and damage caused by the tropical storm across Southeast Africa has led to deaths, displacement, and difficulty accessing health services for many. A surge in flooding is worrying the health and disaster agencies of Malawi and Mozambique, who have already been battling a surge of cholera cases in recent times.
Have you dealt with a stye before? If yes, you are not alone. A stye forms when a tiny oily gland near the eyelashes becomes blocked and becomes infected. It is a painful red bump similar to an acne pimple on the edge of the eyelid. They can form outside or inside the eyelids and can cause the eyelid to swell, crust, or tear. The person may also have sensitivity to light. According to experts, at the US-based Mayo Clinic, a stye generally is not contagious, but it can last 1 to 2 weeks and will usually go away by itself. Medical experts recommend the following steps for at-home treatment of a stye. Apply a warm washcloth to the eyelid for 10 to 15 minutes at a time, 3 to 5 times per day. Keep your eyelid clean by washing with gentle soapy water or use some eyelid wipes. Do not squeeze or pop a stye. Do not rub or touch your eyelid, and avoid wearing makeup or contact lenses until the area has healed. That is our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on Twitter at Mkamiti VOA. Until next time, stay well and strive to make every day a healthy day.